The Mpumalanga Health Department is welcoming a team of doctors from Cuba. The province is ready for the medics to work. 217 Cuban doctors arrived in South Africa last month in a bid to boost the fight against COVID-19. SABC News colleague Sipapile Kunene is standing by. Very good afternoon to you, Sipapile. Mpumalanga has about 76 confirmed COVID-19 cases and no reported deaths so far. Do you know what those Cuban doctors are going to be trying to do during their time in Mpumalanga?
Good afternoon, and yes, they are here in Mpumalanga. We're coming to you from Rob Ferreira Hospital, where they will be welcomed by the provincial MEC, Sasekani Manzini, who will be telling us now as to what exactly are these doctors supposed to help us with as a province.
Thank you very much. Today we are here at Rob Ferreira to welcome the 13 doctors. Amongst them are epidemiologists and also family physicians. They are going to be distributed and also one biostatistics distributed in the different districts. And of course, they are going to assist us in terms of the COVID-19. We can indicate that these are not the first doctors that we are having in the province from Cuba. We have been having doctors from Cuba since 1997, and they are still here, most of them. They are assisting us as a province. So we are happy and excited because they will be also enforcing and making sure that they strengthen in terms of us towards the fight of the COVID-19 during this difficult time.
In terms of stats, Mpumalanga hasn't had any deaths as yet, but the infections keep going up. Can you take us to the stats?
Yes, currently we are at 76 with 53 recoveries. We can say that as a province we are moving towards the right direction, but of course our concern is that we don't want to increase the number of infected people with COVID-19. Hence we are strengthening on our education, bringing different stakeholders to educate our people on the social distance, the issue of washing your hands, when you have got symptoms to visit your nearest clinic, and also intensify our screening campaign in terms of the door-to-door. But further than that, we've realized that in terms of the screening, there are quite a number of people that are screening at our clinics, at our hospitals, of which is encouraging. That on its own, it shows that our people are heading to the call where we're saying, even during the COVID-19, if you feel like you're not feeling well, visit your clinic. So our people in the province are using the clinics also in hospitals. So we can say that we are also encouraged by the number of recoveries that we are registering as a province, and we will continue to make sure that we identify getting those people in the different areas and municipalities in the province.
Quickly, MEC, we have two hotspots, Pixley Sagaseme in that other side, Hartsibande, and we have Nkomazi here at Etlanzeni. Will we see most of these doctors being deployed to those places that seem to be problematic?
Our approach is that we want to approach it at a district level, so that as much as they are placed in different hospitals, but the approach is that they must assist all the different hospitals being allocated at the district level. That is the approach that we want to take, so that we don't leave any municipality, because today we might have Nkomazi and Pixley, but tomorrow we might have another municipality being the epicenter. But of course, talking about Nkomazi and Pixley, we are seeing those that were infected recovering. So it tells you that the shift in terms of epicenter, it can change. So we are ready, hence we are putting them at a district level, that we want to use the district approach in terms of assisting us as a province.
Thank you so much, MEC. That was the MC for Health in Mpumalanga, basically telling us about the doctors that came from Cuba to help the province better fight this disease, COVID-19. And we know that Cubans are good with public health. Therefore, they don't mind traveling to our rural areas where they will be deployed. Districts will be used so that they reach far more places. Back to you in studio.